So we actually have more focus on the fruit and vegetable voucher redemption because that is sort of a newer entity, and it's something that is a cash equivalent. Some states are at high redemption we're looking at right now, but yeah, it sort of varies. And then there are certain foods that different agencies will see that their populations aren't redeeming, or they'll ask them what they're not redeeming. It's in EBT states, which are the electronic states that are on the card, they can actually track which foods aren't being redeemed and then target nutrition education outreach about those foods. So if they're seeing that beans are not being redeemed, they will do a cooking class perhaps on this is an example of this comes from Texas because they're on the electronic card and they've talked about how they've used their data to help improve their nutrition education, and then they saw the redemption of
There's science that shows that there's transgenerational effects of malnutrition. There's a study that was done in Guatemala in the 60s that showed that we're following multiple generations out and you see the impact several generations down the road. There's a study that was funded in West Indies that's also done a longitudinal study looking at these kind of things. So it's not really new. What's new is our tools for evaluating it. And as we develop those tools, we can get more refined in how we target individuals and see really what the problems are.
Birth defects of the brain, spine, and tooth defects. So they're much more likely among Hispanic women. Thought to be nutritionally related, but it could be some underlying genetic related issues as well. So it's another other ethnic minority populations.
Okay.
Same with some of the micronutrient issues. We're learning a lot about vitamin D and bone and disparities in that context. So there's biology to it, like all of this. It's a
gene that regulates that. Example, Asian populations are much more likely to have this factor, so they're less able to essentially metabolize folic acid, and very high prevalence of neurotubular defects in some areas in China, where this gene actually happens to be very prevalent. So the underlying biology plus the environmental piece of it. So it is kind of a complicated story, but we're just
around the prescriptions and the contraindication.
Treating for two. It's a great opportunity. So, we in the United States, because obviously we don't include pregnant women from an ethical standpoint in any drug that's tested and marketed. We have to take information from observational studies, so not randomized, the gold standard randomized clinical trials. So we've been doing with our research, our big study, we've been doing research looking at essentially the safety of all of the pharmaceuticals that are marketed to be able to provide women and their physicians with much better information about what to use and not to use during pregnancy. So if you're treating major depression, there may be different drugs that you might want to think about. You might want to plan this prior to pregnancy. That's the whole idea of the preconception care piece. So we're putting all that information together, and we're trying to make it accessible to healthcare providers and to women to really guide the practice. At the same time, trying to identify the gaps in knowledge.
The fact that nutrition and nutrients are involved in all aspects of drug metabolism. So if you're at risk for nutrient deficiency, many of the enzymes that are used to process these drugs are in fact, all of them are dependent on nutrients. And so if you have a deficiency of a particular nutrient or an excess of a particular nutrient, it will affect the pharmacodynamics and pharmacokinetics of drugs. And so we really need to get a better understanding of these relationships, not just in women in pregnancy, but across the population.
I had an infancy, you mentioned that, and that is, the leading cause of mental retardation, and that started to resurface here in the United States. I was wondering if you had any numbers on what percentage of women or the population.
Journal of Thyroid, there's a letter that just came out on the most recent data. Actually shows, very concerning. So it shows that in the last, since early 2000, pregnant women, they need, as was noted earlier, they need higher levels of iodine, and the most recent, the 5-6 years, going back to about 2003, 2005, shows that the median urinary iodine level for women, for pregnant women, is below the sufficiency level. So, a very concerning trend, and we're not clear about what the obviously very low iodine levels in women. The health effects are well described. This sort of gray area, we're not quite as certain about those levels, but still something that we're thinking about, and actually thinking from a strategy standpoint of iodizing, as was mentioned, in processed foods, which is obviously a big source of salt, of actually trying to use more iodized salt in processed food. But you have to be careful of that. Sure.
I think our ability to assess nutritional status is going to be critical. We tend to think in a very siloed way about things. Historically, we thought about nutrition as being undernutrition, and so we have programs that are designed to deal with undernutrition, but in fact, we're learning that it's much more complicated than that. So I think one of the most compelling issues that we have and that we're going to have to grapple with is how do we assess someone when they walk through the door who may be diabetic, overweight, and poorly nourished and pregnant, and what do we say? This is an issue that's come up in arenas such as the HIV arena, where it's clear that that there's a very complicated interplay between the drugs, the disease, other conditions, and how we deal with that is going to be very complicated. In terms of a specific area that I think is really exploding, the two areas that I mentioned, one is inflammation, because the inflammatory process is so critical to all health conditions, health and disease. But the microbiome, which is, it sounds very complicated, and it is, but basically what we're talking about is that ecosystem within us that keeps us in balance. And these bugs, these microorganisms are critical to our health. And what's a healthy microbiome? How does that microbiome contribute to health and disease? What's the interplay between the microbiome and nutrition and other things? How do drugs get metabolized in a microbiome that's out of whack? And there's different microbiomes throughout our system. There's a GI microbiome, there's a skin microbiome, there's an oral microbiome. So there's the understanding of that and how it interplays, and particularly from the developmental point of view, it's critical. Those factors that impact the development of the microbiome from an early age. We're learning some about that with regard to feeding practices, the importance of breastfeeding and mother's health, and not just the nutrients in human milk, but also these bioactive components in human milk that really that's their only role, is to interact with the microbiome. And it's critical.
For me, then, I'm thinking about the challenges. I mentioned two of them. I think all of us talked about the issue around overweight, obesity, and diabetes. I mean, from a maternal, prenatal factor, it's hard to know what will be like in 10 years, but we need to have some strategies now. And obviously, it's hard to achieve for many people. Hard to achieve a healthy weight prior to pregnancy. So it's thinking about some of understanding a little bit more about the mechanism so we can achieve healthy pregnancies now.
I'm dying to ask you one last question. So on the Hill, you hear a lot of people saying, well, you can't change, Joe Sixpack wants to eat his burgers and gain weight and smoke his cigarettes. You can't change behavior, can't legislate, behavior and whatnot. Have you seen the opposite of that? Would you agree with that, disagree with that? Might be out of the scientific NIH realm, but in terms of, having an impact on changing people's behavior and lowering overweight and obesity problems.
Well, we have a WIC program. The WIC program does that. We heard evidence about the WIC program doing that. I presented some evidence of a study in Pennsylvania that did that. Personally, Joe Sixpack can go do what he wants to do. I'm concerned about that baby and that mom and the impact that's going to have. And we can absolutely have an impact there. And we have to. We're morally obliged to have an impact there, because we cannot continue along the path that we're going on. The implications, we've already seen the impact of it economically and in terms of the health costs. We cannot allow it to continue. So the earlier we intervene, the better. And we need to learn more about, the biology, the mechanisms, and we need to learn more about the context and how to really get those messages out in an effective way.
And as I mentioned in my little talk, the pregnant mom she's a very captive audience. She really wants the best for her child. So even if she hasn't always been the best in terms of healthy behaviors, this is like the opportune time to help change those behaviors because she wants to have a healthy pregnancy. She wants to have a healthy child. And then part of what the WIC program does with the informational interviewing that I mentioned is that the nutritionist works with the mom to sort of develop step-by-step goals that she can achieve versus saying necessarily, you have to completely change your life a whole 180 degrees right now, rather than she comes up with her own goals of what she wants to do, and then the nutritionist helps her sort of meet those goals with specific advice on how to do that. So I don't think it's in this population doomed. I think in this population we probably have the best chance of changing behavior. So we should take advantage of that.
So I'm just going to say two quick things, and what public health is all about: making healthier choices easier. So making healthy choices the default option. So we heard about, access to physical activity, access to healthy foods. Just make it easier for people to actually live healthy lives.
Thank you very much.
Thank you.